In our famous state song, New Oklahomans were excited. They were thrilled about their new state and the possibilities. Democrats in Oklahoma believe it's time for Oklahoma to once again feel that excitement. But it's hard. It's really difficult right now with the situations that we face with education, with health care, with jobs in the economy. So it's our plan to make Oklahoma a brand new state. Basically, we are going to be addressing three broad issues: education, health care, and jobs. So let's start with education. Our children cannot learn in overcrowded schoolrooms. It's difficult for teachers to teach, and it's difficult for children to learn when we have oversized classrooms. Teachers also have to have the supplies they need. Most teachers are having to either use their own money to purchase supplies, or they're having to try to raise money. That's unacceptable in our state. Teachers need to be valued and respected. This is not about a paycheck, and this is not about a salary. This is how our teachers are being treated, and that needs to change. We need to be able to get them the support staff they need. We have schools that have a counselor, one counselor in the school, 1 day a week. That's unacceptable. The teachers and our children need that support. We need support staff. I don't know if you can drive by a school in my district without seeing a sign out in the front yard that says, we need cafeteria workers and we need bus drivers. Those are important support staff that we need. We need to have teachers' aides to help our teachers in the classroom and to help our children. And lastly, for education, we need to have proper funding. And we need to know that we're going to have proper funding every single year. It is not fair and it is not practical for our teachers to go literally year to year not knowing what the funding is going to be. Parents need to know what the funding is going to be. We need to come up with a long-term, long-range plan for funding for education.
I'm going to be speaking about healthcare, but first I want to say how excited the House Democrats are to be announcing this unified legislative agenda with the Senate Democrats and the Oklahoma Democratic Party. I don't know of another time when we've been able to do this, and that is a testament to not only our strong caucuses, our members in the House and the Senate, really wanting to work together, to come together, but also it's a testament to how clear the issues are when it comes to what's facing our state and what we need to do to become that top 10 state that Governor Stitt talks about so often. On healthcare, we've talked about this for a very long time, and we believe it is far past time to bring our federal dollars home to ensure 250,000 more Oklahomans. For a 9-to-1 match, we can ensure those 250,000 more Oklahomans. We know that we're paying those taxes right now to the federal government, and those taxes are going to fund health care in other states. When you look at top 10 states, when it comes to health care, those top 10 states have one thing in common. They have all expanded Medicaid to insure more of their citizens. Oklahoma has one of the highest uninsured rates in the country, and we know that that is one of the key factors when it comes to our poor health outcomes. Going along with that, expanding Medicaid will make sure that we can keep our rural hospitals and our veteran centers open. We've all seen the headlines. It seems like day after day we see a different rural hospital that's either declaring bankruptcy, on the verge of not being able to make payroll, or closing entirely. Many rural citizens are having to drive 100 miles just to have a baby. That is simply unacceptable, and we believe that Oklahomans deserve better. We are firmly committed to criminal justice reform, and you will be seeing a lot of support from us in that area. But we see criminal justice reform primarily as a healthcare issue, because we believe that the main driver of our overburdened and overcrowded prisons is because we don't have access in this state to mental health and substance abuse services. We know that citizens want those services, they need those services, but when they're unable to access those services, they inevitably end up in the criminal justice system. And then when they get out of the criminal justice system, when those services aren't available, they come back into the criminal justice system. So it's a vicious cycle that we must stop. We are firmly committed to various aspects of the criminal justice reform agenda that you've seen and heard a lot about this session, but we believe that funding mental health and substance abuse services is the key component to making sure that we fix this problem for years to come. In terms of jobs and the economy, we have three main points on that. We have several pieces of legislation filed to restore the earned income tax credit, which will allow low and middle income families to keep more of their hard-earned dollars. We also believe that we should lower the tax burden in terms of income tax for lower and middle income families. And we believe that we must end tax breaks that we know don't benefit most Oklahomans and don't create jobs. We've talked a lot about the capital gains tax exemption, and we have legislation filed once again to end that exemption that only benefits a few at the top.
Our caucus is also very committed to criminal justice reform, as is the House Democrats. We believe that in addition to what Representative Virgin has just discussed, that no discussion of criminal justice reform is complete unless you include the topic of funding our courts. The two issues go hand in hand, they exist together, and they need to be solved together. Lastly, regarding the economy, we believe that every Oklahoman deserves an opportunity to work. We believe that in order to sustain yourselves in this state, we see many, many people who are having to work two jobs just to be able to pay their rent, to pay for gasoline to get to work, to be able to pay for clothing and food for their children. We need a livable wage for all Oklahomans. We need to have an increase in minimum wage. And with that, I think we're ready for some questions.
Would you like to do that minimum wage?
The problem that we've had in the past is we have to wait for the federal government to do it. I personally would like it to be a city-by-city option to raise it to the level if we can't have a statewide, then let the cities determine what's best for their city. You know, we hear a lot about local control. It's our second option. I'd prefer that we have a statewide minimum wage. But if we can't do that, then we'd like to see local control reinstated for these cities so they can make a decision on a case-by-case basis.
But your education agenda is pretty lofty, very short on specifics. How are you going to pay for that?
Go ahead.
Sure. So the Oklahoma Education Association, in terms of classroom funding, we put in $50 million last year, and what their plan calls for is $100 million new dollars over the next, $150 million new dollars over the next 2 years. And so we think that with growth revenue, with making changes to the tax code and repealing those credits and exemptions that don't create jobs and only benefit a few, we think that we can fund that plan sufficiently.
What's the dollar amount, total dollar amount?
For the classroom funding, it's $150 million.
Bring any, on the other side, on the earned income tax credit, any reception from Republicans to that idea?
Yeah, we've heard several Republicans who are receptive to it, and with the growth revenue, I think it's very doable this session. It's about a $29 million cost to the state budget, and so we think that in this type of budget year, that is something that we can accomplish pretty easily. The problem will be that when we get to the end of the budget cycle, and when we get to the end of the session and we're writing the budget, there are going to be a lot of agencies and a lot of needs. And so we think that that will be a priority for us. We hope that it will be for the Republicans as well. But I've heard many Republicans say to me that they wish they hadn't done away with it a few years ago when the budget times were bad. And we all remember when we were doing away with credits and exemptions at that point, we weren't looking at things like capital gains. We were looking at things that affect low and middle income families like the earned income tax credit.
You talk about 4-day school weeks in this press release. How is your position different from the Senate Republican caucus, just calling for 5-day school weeks?
We're grateful that the Senate Republican caucus has decided to join us in our argument that we've had for years that we need to get back to 5-day school weeks. We feel like it's great that we're going to have a unified message on that. Better late than never.
Do you mandate that, or do you incentivize the districts? Because a lot of these districts really like it.
And that's a good point, and that's part of the discussion. Everybody needs to be at the table. We need to have teachers and parents, educators. We need to sit down and decide which way we go on that.
I'll say something.
Go ahead.
Too. We believe that it's not something that we should mandate. It's something that we should provide funding for. And when we take care of the classroom funding issue and the teacher pay issue, we'll take care of the things that have led to the 4-day school week. We know that administrators are doing this so that teachers, it's a teacher recruitment tool, so that they can have a day off or so that they can have a day off to go get a second job. And some families do enjoy it, but there are a lot of other families who simply can't afford childcare on Fridays. They're scrambling to figure out what they'll do with their child each Friday. And there are a lot of kids in the state that depend on breakfast, lunch, and dinner at their schools. And so we feel that it's just irresponsible of the legislature not to fund schools appropriately to where they can keep their doors open 5 days a week.
The governor seemed backpedal yesterday on Medicaid expansion. Y'all have pointed out that you take other federal dollars, it's not an issue. What's the real issue with Republicans not wanting to afford this?
What I think is that they're simply looking at politics and not good policy and what's good for the citizens of the state of Oklahoma. We know that this was something that was instituted by a president who many of them opposed, and that seemed to be the reason why they opposed it during those 8 years. But we have a new president. The Medicaid money is still on the table. They're not yanking it back from other states. That argument is just simply a fallacy that we can't depend on this money. Other states have been depending on this money, our money, for 10 years now.
Okay, I got
And
some
I-
reaction too. Would you mind?
No, I'd be happy to. It's our position also that when the governor said we can't depend on federal monies, we're worried that they will take it back. If you all look through the budget and the handout yesterday, you see that Department of Transportation, ODOT, is going to get over $700 million of federal money this year. DHS is going to get over close to $100 million. The money is taken for other areas. We've taken federal money for ODOT, for human services for decades, and there's never been a concern that the money's not going to be here next year. So I'm not going to speak to what the governor's true motivation is, but we don't believe that the money being taken back is a valid reason not to accept the Medicaid dollars that we've been spending. We've been sending to the federal government, and they've been spending it on Medicaid programs all across the country, and we've lost out. It's time for that to change.
Wait, just follow up then. So can you believe that it's tied somehow to Obamacare? How do you sell this to Republicans?
Well, I think you sell this to Republicans because in their districts, hospitals are closing. And when you look at the health outcomes, like I said, one of the main indicators, one of the main reasons why we're so low in health outcomes is because of our very high uninsured rate. And so when you get people who are insured and they can depend on health care, they can go to a primary care doctor instead of going to the emergency room for primary care, then all of those outcomes can change. It's simply, like I said, it's simply politics, it's not policy. And in terms of the concern about taking the money back, there are several stopgaps that we could put into the legislation, saying if the feds take back their money, then the program ends on our part as well. And so there are several ways that we can do that. That's simply an excuse not to do this very good policy.
Do you think that if it could increase efforts to get an initiative petition to get on the 2020 ballot, that might also change some House and Senate races should it get on the ballot?
I can't speak to what effect it would have on legislative races. I think it certainly would have an effect on turnout statewide because a lot of people are concerned about this issue. But what we've seen in other states, in other red states, and other conservative states, is that when this issue gets on the ballot, it passes. I don't know of any state where it's actually failed. And so what we've said is we would rather get this done legislatively rather than putting it to a vote of the people because, frankly, it's our job to do that. We shouldn't have to put everything to a vote of the people. We shouldn't have to put those tough decisions to a vote of the people when it's our job. But what we've said also is that when you look at the language that would be on the ballot, it probably wouldn't involve the legislature in implementation. And so we think that the voters put us here to decide how to implement a program like that. And if we had it on the ballot, then it would probably cut us out.
But do you think that his remarks yesterday sort of increased fuel on the fire to get it to a vote, or is it too soon to say?
I don't know. I haven't heard much reaction on that, but I think that probably is something that is motivating the majority party, is that they see that this is a real possibility that it might be on the ballot in 2020, and they know that it's popular with the voters and with the citizens, and so they may be trying to head that off.
Leaders, so we know that the Republicans have a supermajority in both chambers this year. What is your strategy going forward to make sure that you can make sure part of your agenda is at least heard this session?
Representative Virgin and I probably have a different take on this, simply because when you look at the size of the Senate chamber and the percentage minority majority, it's a little bit different from the House, and I served for the House in 2 years. We're going to continue to do what we do. We are going to continue to go to committee, to ask the hard questions, to talk to authors, to point out problems we see, and continue to move forward to debate on the floor and do the same thing. If you look at how the Democrats in the Senate have handled the past few sessions, you'll see that about 20 to 25% of the time, we definitely are a voice to be reckoned with, because the votes just don't have the votes to get there without us. So we're going to continue to flex our muscles. We'll compromise when we absolutely have to, but we'll stand by the decisions that we need to stand by for what's best for our districts and our constituents.
And as I've said many times before, we take our responsibility as the minority party in the House very seriously. As Leader Floyd said, it's our job to ask those tough questions to make sure that nothing's hiding in legislation. But I think we've shown, excuse me, over the past 2 to 3 years that we do have power in the House, especially when it comes to the revenue conversation. Without us, the teacher pay raise bill last session wouldn't have passed. It wouldn't even come to a vote on the floor. We wouldn't have raised the gross production tax to 5%. We wouldn't have done a lot of things last session when it comes to revenue. And so we think that we will still be relevant in that conversation, and we will take that responsibility, like I said, very seriously.